Hello friends and all the viewers, welcome to my YouTube channel Amazing Science BS Nursing Lectures. फ्रेंड्स आज की इस वीडियो में मैं डिस्कस करने वाली हूँ लम्स यूनिवर्सिटी के पास्ट मोस्ट रिपीटेड BCQs. दिस इज अ गेस्ट पेपर ऑफ 2024 फंडामेंटल ऑफ नर्सिंग फर्स्ट ईयर फर्स्ट सेमेस्टर. सो फ्रेंड्स अगर आप हमारे चैनल में न्यू है तो चैनल को सब्सक्राइब करें, बेल आइकन को हिट करें और बगैर देर के वीडियो को स्टार्ट करते हैं. फर्स्ट में MCQ है, oral temperature is contraindicated in the following situation except. तो फ्रेंड्स ओरल टेम्परेचर जो है कंट्राइंडिकेटेड है सारों में, एक्सेप्शन बतानी है किस में नहीं होता. सो फ्रेंड्स थिन पेशेंट्स इज द करेक्ट ऑप्शन. फ्रेंड्स नेक्स्ट MCQ, विच ऑफ द फॉलोइंग इज नॉट अ स्टेप ऑफ नर्सिंग प्रोसेस. कौन सा इनमें से जो नर्सिंग प्रोसेस का स्टेप नहीं है? तो फ्रेंड्स साइंटिफिक रेशनल इज द करेक्ट ऑप्शन. नेक्स्ट MCQ है, the force exerted against the skin when a client is moved or repositioned in bed by being pulled or allowed to slide down in the bed is known as shearing. Friends, next MCQ, for assessment of activity and exercise pattern, which of the following physical examination should a nurse not perform? So friends, इसका जो correct option है वो है mental status examination. Friends, next MCQ, which of the following system is one of the first to begin to suffer damage from immobility? Correct option is musculoskeletal system. Immobility से जो organ damage होते हैं वो कौन से होते हैं? musculoskeletal system वाले. ठीक है फ्रेंड्स. फ्रेंड्स नेक्स्ट MCQ है, the normal range of adult pulse rate is dash beats per minute. Normal range of adult pulse rate is 60 to 100 beat per minute. In the communication process, humor can be used for. Communication process में humor जो है वो किस लिए यूज होता है? Adjust a client to difficult and painful situation. Friends, next MCQ, for normal human growth and development, which of the following needs should be met first? So friends, correct option is physiological needs should met first for normal growth and development. Friends, next MCQ, basic life support should be started within 4 minutes. Next MCQ, the transfer of heat from surface of one object to the surface of another object without contact between the two objects, mostly in the form of infrared rays, is known as radiation. Radiation is the correct option. Next MCQ, friends, difficult and labored breathing during which an individual feels distressed is known as. तो फ्रेंड्स इसका जो करेक्ट ऑप्शन है वो है डिस्पनिया. फ्रेंड्स नेक्स्ट MCQ, द नॉर्मल ब्लड प्रेशर इन एडल्ट इज. नॉर्मल ब्लड प्रेशर जो होता है एडल्ट में वो कितना होता है? 120/80. ठीक है फ्रेंड्स. नेक्स्ट MCQ, इफ अ बॉडी टेम्परेचर इज बिलो 96.8 डिग्री फ़ारेनहाइट इट इज कॉल्ड हाइपोथर्मिया. हाइपोथर्मिया इज द करेक्ट ऑप्शन. फ्रेंड्स नेक्स्ट MCQ, विच ऑफ द फॉलोइंग इज कॉमन साइट फॉर टेकिंग ब्लड प्रेशर. ब्लड प्रेशर टेक करने के लिए कौन सी जो है कॉमन साइट है फ्रेंड्स? अपर आर्म इज द करेक्ट ऑप्शन. फ्रेंड्स नेक्स्ट MCQ, फ्रंट ऑफ द ब्रेकियल आर्टरी इज लोकेटेड एट. ब्रेकियल आर्टरी कहाँ पे लोकेटेड होती है? तो फ्रेंड्स इसका जो करेक्ट ऑप्शन है फ्रंट ऑफ एल्बो जॉइंट. Next MCQ, a nurse should check the vital signs of the patient on the following occasion except. So friends, correct option is just after exercise. एक्सरसाइज के बाद उन्हें नहीं चेक करनी चाहिए वाइटल साइंस. बाकी ऑप्शंस जो हैं वो रिलेटेड हैं. एक्सेप्शन जो है वो है जस्ट आफ्टर एक्सरसाइज. नेक्स्ट MCQ, द फाउंडर ऑफ मॉडर्न नर्सिंग इज फ्लोरेंस नाइटिंगेल. Friends, next MCQ, a person at high altitude has increased respiratory rate. Next MCQ, the apical pulse is located at apex of heart. Next MCQ, the balance between the heat produced and heat lost by body is called temperature. Temperature is the correct option. Next MCQ, a client who does not have fever is called afebrile. Afebrile is the correct option. Friends, next MCQ, the impact of immobility on the integumentary system is skin breakdown. Friends, next MCQ, while taking oral temperature, the thermometer should be placed in the patient's mouth for 3 minutes. Friends, next MCQ, the most frequent gastrointestinal system problem of immobility is constipation. Friends, next MCQ, which of the following is not a form of non-verbal communication? Spoken words. Spoken words are not a form of non-verbal communication. Next MCQ, in the sequence of CPR, which of the following steps should the nurse perform first? Check responsiveness is the correct option. Next MCQ, blood pressure should be written as C option is the correct one. Next MCQ, any discrepancy between the pulse rate is called pulse deficit. Next MCQ, the inability to breathe easily unless sitting upright or standing is known as. Correct option is orthopnea. Orthopnea is correct option. Next MCQ, which of the following is not a nursing intervention for a client with fever? So the correct option is keep limbs close to the body. This is not a nursing intervention for a client with fever. Next MCQ, which of the following is not a characteristics of normal respiration? Correct option is shallow. Next MCQ, snoring respiration usually occurring due to partial obstruction of upper airway is called stutter. Next MCQ, which of the following is not a nurse's overall goal for client with oxygenation problem? Correct option is maintain inadequate hydration. Next MCQ, which one of the following procedure when performed should not be informed to the patient? कौन सा प्रोसीजर जो है परफॉर्म करने से पहले हम पेशेंट को इन्फॉर्म नहीं करते? रेस्पिरेशन इज द करेक्ट ऑप्शन. Next MCQ, following factors are associated with hypertension except dehydration. Dehydration जो है हाइपरटेंशन का फैक्टर नहीं है. Next MCQ, at the time of admission in the hospital, the nurse should make the patient comfortable in bed, record vital signs, ask about previous hospitalization, observe for sign of weakness, all of the above. All of the above is the correct option. Next MCQ, a blood pressure that falls when the client sits or stands is called orthostatic hypotension. Orthostatic hypotension is the correct option. Next MCQ, in therapeutic communication, which of the following is not an action of physical attending that conveys a posture of involvement? Attentive listening is the correct option. क्योंकि attentive listening जो है वो posture को show नहीं कर रहा. अटेंटिव लिसनिंग जो है वो क्या है? एक ऑडिटरी स्किल है जो कि पोस्चर को शो नहीं कर रहा, इसलिए अटेंटिव लिसनिंग इज द करेक्ट ऑप्शन. नेक्स्ट MCQ, विच ऑफ द फॉलोइंग इज रिकमेंडेशन ऑफ वर्ल्ड हेल्थ ऑर्गेनाइजेशन परफॉर्म हैंड हाइजीन बिफोर एंड आफ्टर हैविंग डायरेक्ट कॉन्टैक्ट विद पेशेंट? A option is with alcohol based hand rub if hand are not visibly soiled. B is after removing gloves. C is before handling invasive device regardless of whether or not gloves are used. So all of the above, all are WHO recommendations. Next MCQ, what are we trying to reduce or eliminate when we are doing hand washing? Viruses, bacteria, fungi. हम जो है इनको रिमूव करने के लिए क्या करते हैं? हैंड वॉशिंग करते हैं. Next MCQ, what is known as sterile technique prevents contamination of an open wound, serves to isolate the operative area from the unsterile environment, and maintains a sterile field for surgery. So the correct option is surgical asepsis. Next MCQ, friends, dash communication occurs within an individual. Intrapersonal communication occurs within an individual. Next MCQ, the individual who first coined the term nursing process and introduced its 3 steps: observation, administration, and validation is. Next MCQ, friends, which step of nursing process includes setting short and long-term goals? फ्रेंड्स, शॉर्ट एंड लॉन्ग टर्म गोल्स जो होते हैं वो प्लानिंग फेज में किए जाते हैं. नेक्स्ट एमसीक्यू, विच ऑफ द फॉलोइंग इज करेक्ट ऑर्डर ऑफ नर्सिंग प्रोसेस? असेसिंग, डायग्नोस्टिंग, प्लानिंग, इम्प्लीमेंटेशन, इवैल्यूएशन. डी ऑप्शन इज द करेक्ट वन. असेसिंग, डायग्नोस्टिंग, प्लानिंग, इम्प्लीमेंटेशन, इवैल्यूएशन. Friends, next MCQ, the name of nursing diagnosis is linked to the etiology with the phrase related to. Related to is the correct option. Next MCQ, the nurse in charge identifies patients' responses to actual or potential health problems during which step of nursing process? Correct option is diagnostic. डायग्नोसिंग फेज में एक्चुअल एंड पोटेंशियल हेल्थ प्रॉब्लम जो होती हैं पेशेंट के नर्स जो आइडेंटिफाई करती है. नेक्स्ट एमसीक्यू, एंशिएंट सोसाइटीज एडॉप्टेड सॉलिडिटी फॉर म्यूचुअल प्रोटेक्शन. म्यूचुअल प्रोटेक्शन इज द करेक्ट ऑप्शन. Friends, next MCQ, the pulse is most often measured by feeling the arteries of wrist. Next MCQ है, post RN bachelor's degree training is allowed after diploma in nursing. Communication is a non-stop dash. Communication is a non-stop process. Next MCQ, the dash is the person who transmits the message. The sender is the person who transmits the message. Next MCQ, movement of limbs in circular direction is called rotation. Next MCQ, the force or strength of the pulse is called volume. Next MCQ, vasomotor central controls dash through vasoconstriction or vasodilation. Vasomotor controls blood pressure. Vasomotor center controls blood pressure through vasoconstriction and vasodilation. Next MCQ, one-way valve prevents dash from re-entering the oxygen reservoir. One-way valve prevents exhaled air from re-entering the oxygen reservoir. Next MCQ, benefits of client teaching are improved quality of care, shorter length of hospital stay, decreased chance of hospitalization, all of the above. Benefits of client teaching are all of the above. Next MCQ, which one is a characteristic of profession? Self-regulation, honesty and integrity, competency, all of the above. All of the above is the correct option. Next MCQ, dash respiration gradually increase in rate and depth and then becomes shallow and slow. Chinese stroke respiration gradually increase in rate, depth and then becomes shallow and slow. Next MCQ, a non-rebreather mask is used in emergency situation to prevent hypoxemia. Hypoxemia is correct option. Next MCQ, the dash pressure is the pressure when ventricles are at rest. When ventricles are at rest, that pressure is known as diastolic pressure. Diastolic pressure is the correct option. Next MCQ, in what position is a patient placed for the enema tip insertion? For the enema tip insertion, patient should be placed in Sims position. Sims is the correct option. Next MCQ, the nurse administers cleansing enema. The common position for this procedure is Sims left lateral position. Next MCQ is after routine patient contact, hand washing should last at least 30 seconds. Next MCQ, what does not make up the respiratory system? Nose, mouth, lungs and heart. This option is the correct one. Next MCQ, respiration is the process of dash between an individual and the environment. Respiration is the process of gases exchange. Next MCQ, the normal reading of patient blood oxygen level by pulse oximeter is measured 90 to 100%. Next MCQ, it is best described as a systematic rational method of planning and providing nursing care for individual families, group and communities. This is a definition of nursing process. Next MCQ, when you put yourself in another's shoes, often feeling things more deeply, it is called empathy. Next MCQ, according to Benner's stage of nursing profession, novice means limited performer or student nurse. Both B and C is the correct option. Next MCQ, it is a process of helping the client to recognize and cope with stressful psychological and social problems and personal growth. Counseling. Next MCQ, provide care and comfort for a person together with preserving the dignity of human being is called caregiver. Next MCQ, hypovolemia means. Hypovolemia means a decreased volume of circulating blood in the body. Next MCQ, hypoxia means. Hypoxia means insufficient circulating blood in the body from inspired gas, insufficient hemoglobin in the body from inspired gas, insufficient oxygen in the body from the inspired gas to the tissues, insufficient oxygen and CO2 exchange in the body from the inspired gas to the tissue. So the correct option is C number. C number is the correct option, insufficient oxygen in the body from the inspired gas to the tissues. Next MCQ, licensed practitioner nursing and nursing technician courses can be applied after 2 years of diploma nursing jobs. Next MCQ, most of us use dash and dash in addition to words when we speak. Most of us use gestures and body language in addition to words when we speak. Next MCQ, dash is an exchange of facts, ideas, opinions, emotions by two or more persons. Communication is exchange of facts, ideas, opinions. Next MCQ, which one is not a step of nursing process? Which one is not a step of nursing process? Scientific rationale is not a step of nursing process. Next MCQ, cerebral function can tolerate hypoxia for only dash minutes before permanent damage occurs. 4 to 6 minutes is the correct option. Next MCQ, cyanosis means. Cyanosis means bluish purplish discoloration of skin or mucous membrane due to low oxygen saturation. Next MCQ, pursed lip breathing is to. Pursed lip breathing is to blow off CO2. Next MCQ, the stage in which skin is intact and shows a non-blanchable Localized redness or erythema over bony prominence is in which stage of pressure ulcer? Stage 1. Dash means communication without words. Non-verbal communication means without words. Communication without words. A dash connects the sender to the receiver. A channel connects sender to the receiver. Next MCQ, Florence Nightingale was born on 12th May 1820. Next MCQ, what is responsible for generating blood pressure? Relaxation of contraction of ventricles are responsible for generating blood pressure. Next MCQ, what is normal range for adult respiration rate? Normal range for adult respiration rate is 12 to 22 breath per minute. Next MCQ, what term describes the process of inhaling and exhaling air in order to exchange oxygen for carbon dioxide? Respiration. Next MCQ, which part of CNS controls respiration rate and depth? Medulla is the correct option. Next MCQ, what is the respiration rate for a newborn? 40 to 60 breaths per minute. Next MCQ, which term describes normal quiet breathing that requires contraction of diaphragm and external intercostal muscle? Eupnea is the correct option. Which condition is characterized by absence of breathing? Apnea. Next MCQ, which intervention is recommended to promote calm atmosphere and aid respiration? Elevating the head of the bed. Next MCQ, what should you observe when checking a patient's respiration rate? Chest rise and fall. Next MCQ, what is the normal respiration rate for school-age children? 18 to 26 breaths per minute. Next MCQ, which condition describes shortness of breath that occurs when lying flat? Dyspnea is shortness of breath. Next MCQ, what is the physiological process of gas exchange in the lungs called? Respiration. Next MCQ, what does labored breathing indicate? Struggle to breathe. Next MCQ, which term describes respiration rates greater than 24 beats per minute? Correct option is tachypnea. Next MCQ, which part of brain controls the dissipation of heat? Correct option is medulla. Next MCQ, what nursing intervention involved elevating the head of bed to aid respiration? Fowler's position. Next MCQ, what is the primary purpose of assessing the color of skin, mucous membrane, nail beds in respiratory assessment? To check for cyanosis. Next MCQ, what is average normal body temperature? Average normal body temperature is 98.6 degrees Fahrenheit and 37 degrees Celsius. Next MCQ, which temperature range is generally accepted as normal for body temperature? Correct option is 97 degree Fahrenheit to 99.5 degree Fahrenheit. Next MCQ, which part of brain is responsible for regulating body temperature? Hypothalamus. Next MCQ, what is set point in the temperature control system? 37 degrees Celsius is the set point in temperature control system. Which of the following is not a factor affecting body temperature? Hair color is a factor not affecting body temperature. What is hypothermia? Body temperature above the thermoregulatory set point. Next MCQ, what does conduction refer to in terms of heat transmission? Transfer of heat through direct contact is the correct option. Next MCQ, which of the following is a type of fever where body temperature periodically rises and falls? Intermittent fever. Next MCQ, at what temperature is fever considered hyperpyrexia? Above 100.4 degree Fahrenheit. Next MCQ, what is core temperature? Core temperature is the temperature of deep tissues of the body. Next MCQ, which type of fever has a temperature that remains above normal for a long period of time with minimal fluctuation is called continuous fever. Next MCQ, which method of heat loss involves the conversion of liquid to vapor? Evaporation is the correct option. Next MCQ, what is hypothermia defined as? Body temperature below 35 degrees centigrade. Which factor does not influence vital signs? Hair length does not influence vital signs. Next MCQ, what is normal range for oral temperature? 96.8 degree Fahrenheit to 100 degree Fahrenheit. Next MCQ, which type of thermometer is not mentioned as a method to measure temperature? Mercury thermometer. Next MCQ, what is body's response when the core temperature increases above the set point? Increase heat production. Next MCQ, what is temperature of freezing water in Celsius? 0 degrees Celsius. Next MCQ, what is final stage of fever characterized by falling temperature, moist skin and sweating? What is normal adult blood pressure reading? 120/80. Next MCQ, which of the following factors affect blood pressure? Blood volume, strength of contraction, elasticity of arterial wall, all of the above. All of the above is the correct option. Next MCQ, what is the term for blood pressure that is consistently below normal? Hypotension. Next MCQ, what is systolic pressure? Pressure of blood as a result of contraction of ventricles. B option is the correct one. Next MCQ, which equipment is used to measure blood pressure? Sphygmomanometer and stethoscope. Both are used during measuring blood pressure. Both B and C. Next MCQ, what condition is indicated by an elevated blood pressure of unknown cause? Primary hypertension is a condition indicated by an elevated blood pressure of unknown cause. Next MCQ, which blood pressure reading indicates hypertension? 140/90 indicates hypertension. Next MCQ, what is orthostatic hypotension? Blood pressure that falls when the client sits or stands. This is the correct option. B option is correct one. Friends, next MCQ, what should be monitored carefully to prevent falls in hypotensive clients? Blood pressure. Next MCQ, what lifestyle change can help reduce the risk of high blood pressure? Reduce weight. Next MCQ, which civilization believed in black and white magic and practiced health techniques such as bone setting and hot and cold bath? Ancient societies believed in black and white magic, practiced health techniques such as bone setting and hot and cold bath. Next MCQ, what is focus of nursing according to Florence Nightingale? Theoretical and practical basis in the care of sick is the correct option. Next MCQ, what was one of the contribution of Eastern Orthodox Church in the field of nursing? Founding hospitals in the Middle East is the correct option. Next MCQ, which nurse is known for training women and young girls in the art of nursing in Saudi Arabia? Rofeda al-Islamia. Next MCQ, the ANA Code of Ethics was approved in American Nursing Association. ANA means American Nursing Association. Code of Ethics was approved in which year? 1953. Next MCQ, according to Philip A. B. Trash and J. Kelly, which image of nurses was dominant from 1945 to 1965? The mother. Next MCQ, who wrote internal medicine in ancient India? Charaka wrote the internal medicine in ancient India. Next MCQ, what is the root word of communication and its meaning? Root word communicare, to share. Next MCQ, which of the following is not a characteristic of effective verbal communication? Volume. Volume is not a character of effective verbal communication. Next MCQ, which factor is not listed as influencing communication? Time management. Next MCQ, what is an example of therapeutic communication in nursing? Asking open-ended question. Next MCQ, what does the therapeutic communication aim to achieve? To create a beneficial outcome for the patient. What is non-therapeutic response? Asking why questions. Next MCQ, which technique involves making self available and showing interest and concerns? Offering self. What is the purpose of documenting the events in sequence as they occur? To maintain accuracy. Which technique of effective communication involves asking for the relationship among events? Placing the event in time or sequence. Next MCQ, which legal aspect of documentation is not necessary? Client's initial legal aspect of documentation is not necessary. Next MCQ, what is primary function of respiratory system? Oxygenation. Next MCQ, which of the following structure is not part of upper respiratory tract? Trachea is not a part of upper respiratory tract. Next MCQ, what is the role of hemoglobin in oxygen transport? ऑक्सीजन ट्रांसपोर्ट में हेमोग्लोबिन का रोल क्या है? टू बाइंड ऑक्सीजन एंड कैरी इट टू द टिश्यूज. नेक्स्ट MCQ, what is the normal range of arterial oxygen saturation in a healthy individual? 95 to 100%. Next MCQ, which of the following condition can lead to hypoxia? High altitude. Next MCQ, what is the primary muscle involved in respiration? Diaphragm. Next MCQ, which part of brain regulates the respiratory rate? Medulla oblongata. Next MCQ, what is the normal respiratory rate for an adult at rest? 12 to 16 breaths per minute is the normal respiratory rate for an adult at rest. Next MCQ, what is the effect of smoking on the respiratory system? Damage to cilia and alveoli. सो फ्रेंड्स, यहाँ पे MCQs एंड होते हैं. अगर आपको हमारा वीडियो पसंद आया तो चैनल को सब्सक्राइब करें, वीडियो को लाइक करें एंड शेयर ज़रूर कीजिएगा. कमेंट में लाजमी बताइए आपको हमारा वीडियो कैसा लगा. अल्लाह हाफिज़, मिलते हैं नेक्स्ट वीडियो में.